Now, when you're looking at more regression-based autism, I know there's a lot of arguments about vaccines, no vaccines, and so forth. This is not about what this is about. This is about early intervention. Regression does happen. Here's a picture of my child, my last good picture of him at around 12 months. And this is him right there after he had his vaccines. In Graham's case, I know it's extreme, he actually got the disease. It was not caught for years. So what I don't necessarily believe that we're ever going to have the proof that you have a vaccine today and tomorrow the child has autism. I don't think that's going to happen. What I do believe is that a lot of the vaccines, especially multi-vaccines, create so much trauma to the system that had I known to get right in there to get my child back with early intervention, his world would have been different. But I didn't know. You know, my child was sick. I kept expecting him to get better. But the prolonged sickness, the vegetative state and so forth, when he's just like this, how do you learn how to play with toys? How do you learn what your name is? How do you learn how to speak? He was working so hard on just how to think and to breathe and for his heart to work. Speaking and all these other things were just out of the question. So these are, again, they do happen. There's just too many moms. Be nice to the moms out there. You know, our kids, it's just a lot of work sometimes, and they just need help. They don't know, and they're just learning piecemeal here and there. It's very hard when a doctor's saying, which I've been told, I'm wasting my time, I'll never know what's wrong with my child, when he had a massive infection. So it does happen. And sometimes it does take years for a diagnosis, and it doesn't happen like it does on TV where a child has a seizure and the next day you have a diagnosis. You know, it's not even just a couple of weeks where you have answers. Sometimes it's months, it's years. Even for autism, most kids aren't diagnosed until about 3 years old. And that's usually after professionals have come in and said, okay, this child has not done what it needed to do to progress, and it needs help. I'm here to say, let's help a little bit early. And these are what to look for. Now, for regressive-based intervention, things to need to look for. Is a child suddenly non-responsive? Did you suddenly could talk to the child, again, that name recognition, and all of a sudden you're just not getting your child responding to you? Are they not talking or looking or so forth, like they seem preoccupied, but more with that dazed look, that glassy-eyed look, that they're off to the corner, like it doesn't even make sense what they're focusing on. You'll see kids with autism like this, where they'll actually be talking to you in big full sentences, but they're not looking at you, just like I'm doing now. And it's not until they're done talking that they come back to look on. So you want to, what I was doing with my child was I suddenly was raising my voice like he wasn't hearing me, or touching my son to get his attention. So these are things, that's one thing to start looking forward to. And again, what I just said, is this staring, that sort of nondescript looking off kind of thing. You see it more in publicized books of the boy who like to look out windows, or where it's a more obvious form of staring, but the staring doesn't necessarily have to be obvious. You think they're kind of watching TV and they're not. Just something to look for. They have suddenly sensory systems where they could just get messy and muddy and it was just fine, and all of a sudden there's a, and you'll see this again, I can use Graham as an example, my son. Here he is just eating, just fun, and now you're seeing him just having the sensory, it's almost like the food is just literally attacking him, the panic that's just in his system because of icing. If your child's suddenly fearful, that they're afraid, mommy don't, and again, this can be normal to children at times, but it's that overall fear, that panic, get your shoes on, where are we going, where they just are in a panic all the time, or fear, or wanting to be held, or wanting to be, because that can be a combination of the sensory, noise, is a sensory. If you take your child to a major department store and they're just freaking out, usually it's sensory overload is what's happening to them, especially when you're seeing it more and more. I tried not to shelter my child from that. If they had a bad time at the restaurant today, I'd go back to the same restaurant. Our world is about noises and smells and so forth, and I try to allow the child to get used to it, but it's something to look forward to in a young child. If your child is slouching, healthy babies don't slouch. They're always this, they're upright, they seem to have great little postures. If you're suddenly seeing just the slouch of a child, they're not protecting the central nervous system. The brain is off, and it's something to really bring up to the pediatrician. Pediatrician might not be too familiar with a quote slouch. They might use words like low tone, hypotonic. But again, it was if your child was not having the low tone issues prior to a year and then all of a sudden they're losing muscle mass, not a good sign. And it might be something, and again, to be double checked with the neurologist prior to jumping to the autism conclusions. Again, it's just to rule out different medical things, but if there's a change to physical appearance to your child, and your pediatrician's not giving you the answers, it's a time to step it up and maybe go to a specialist. And we'll be talking about what specialists do in different areas. I'm hoping to interview a bunch of different doctors just to explain what they do so you know why you would talk to a neurologist or gastroenterologist and even what they mean. A neurologist is for the brain and a gastroenterologist is for the intestinal tract, the digestive system. And again, a lot of people just don't know this. So those are the things to look for in a child with regression. Non-responsive suddenly. You find yourself turning the TV up as if they're hearing impaired, and it's something to have checked out, their hearing, but usually again their brain is just not feeling well. That to respond, it's just difficult. Staring off for no reason for long periods of time. A young healthy baby should be curious, going around to this, to that, to the other. Sensory and touch, suddenly having a problem. Sensory, it could be going to bed at night. And again, these might be little normal patterns of going through, but if you see it overload constantly in little situations, they suddenly don't want to get messy. Food starts becoming an issue. Again, it's something to look into to see if they can be avoided or not going on to long periods of times. Child suddenly fear-based. And if your child's slouching. So these are warning signs to look for that your child has suffered some form of regression and you really want to get in there and start doing some early intervention. Thanks.